The Agenda in the Summer with Nam Kiwanuka is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Local health officials stepped up as never before in this past year and a half. I'm Nam Kiwanuka. TVO is pleased to partner with the Association of Municipalities of Ontario as they hold their annual conference this week. And tonight on the Agenda in the Summer, how Ontario's public health units are coping. There are 34 public health units in Ontario, and every one of them has worked tirelessly throughout the COVID-19 pandemic. How are they holding up, and what lessons have come out of this emergency? On that, we're pleased to welcome, in Sioux Lookout, Mayor Doug Lawrence, who is also chair of the Northwestern Health Unit. In Peterborough, Ontario, Andy Mitchell, Mayor of Selwyn Township, Ontario, who is also chair of the Peterborough Board of Health. And in Kitchener, Ontario, Karen Redman, chair of the Regional Municipality of Waterloo and their Board of Health. Welcome to you all.
Thank you.
Thank you.
It's very nice to see you all looking good. I just wanted to bring up a map to give people an idea of where each of you are in the province. Sioux Lookout is located in the northwestern corner. Peterborough, also known as the gateway to the Kawarthas, cottage country, is south in the central region. And Kitchener in the southwest, about an hour and 15 minutes from Toronto. Before we begin our discussion, let's get some background on public health in the province. And this is all according to the Association of Municipalities Ontario, or AMO. There are 34 public health units that provide population health services to Ontarians across the province. They work with municipal governments to help prevent disease and to keep people healthy. Municipal governments play a major role in the delivery of public health services, both as an employer, when in a municipality, and funding partner. As of 2020, public health funding is split 70% provincial and 30% municipal. Chair Redman, I just wanted to maybe give people who are watching or listening to this an idea of what public health units do, how they serve their municipalities. Can you give us a quick overview?
So very much public health is involved, as is the region of Waterloo and other public health units, with the delivery of the determinants of social health. And it can be income and social protection. Public health units inspect restaurants. They make sure that they have healthy baby visits. All of those things have continued to go on during the pandemic. But in addition to that, they have made sure that there is compliance and education as we had worked through the different color framework steps. And now we're into step 1, 2, and 3 of coming out of the pandemic. So really a lot of heavy lifting. And I would have to say, Nam, that that 5% shift from 75-25 to 70-30 puts municipalities on the line as being the entity that now has to raise taxes or say no to some levels of service. So it's a difficult spot to be in during a pandemic.
Well, I was actually going to bring that up because as things stand now, public health funding is split 70% provincial and 30% municipal. Before it was 75 and 25%. You gave us a little bit of an idea of where you stand, Chair Redman, but I want to ask all of you, both Chair Redman, what are your thoughts on that ratio?
I think I have to tell you that during this pandemic, municipalities have never been more focused on by the federal and the provincial government. I would tell you that this is a subtle kind of downloading, which has been pretty historic throughout history from different provincial governments, and it really does hamper how we can serve clients at a time when we know that there is an increasing demand for those services.
And Mayor Lawrence, what do you think?
I think two things. The emphasis on 5% is incorrect. The change from 25 to 30% is 5 over 25 is a 20% increase there. And the province also changed the cost share formula where some programs that were previously cost shared are now 100% municipal. So the actual change is 35% increase in our municipal costs. It also demonstrates prior to COVID, and I hope that's changed, the lack of value that this government placed in public health.
And Mayor Mitchell, what do you think?
Well, I'd have to agree with my colleagues, and I think the best way to look at public health is to understand that's where the rubber hits the road. The province puts forward a number of guidelines. It puts forward a number of criteria. But at the end of the day, it's local public health units working with local partners and local populations that deliver on it. And as far as the funding is concerned, that shift was not only the 5%, but it was also taking the programming that the government used to fund 100% and said we were going to have to fund it 30. For us, it's close to $1 million a year, and it equates for the county of Peterborough, who collects the revenue for this, up to a 2% increase in taxes. And that's just on public health, not counting everything else that might have to be done. So the issue of affordability is a tough one, and this has made it even tougher for us.
And I can imagine, too, before the pandemic hit, I think a lot of us weren't aware of what public health did and what their roles were. And Mayor Lawrence, it seems like a lifetime ago, but right before the pandemic hit, the province had floated going from 34 public health units to 10 with new boards. Where do things stand right now, Mayor Lawrence?
Well, we have no idea. They stand behind the curtain of COVID in terms of what the government's intentions are. But one hopes that the government has realized through COVID the value of local control, the value of a decentralized model of public health, that certainly our public health unit, which covers about 20% the area of the province, covers the entire Manitoba borders with the U.S. and also borders essentially with the Arctic Ocean on Hudson Bay, a huge area that I would argue that if centralized control somewhere 1,000 kilometers south of our health unit, they would have no idea of the issues and challenges we face.
I mentioned that maybe COVID-19 has opened the eyes of Ontarians of what public health units do. But from your vantage point, and this question is for all of you, do you feel that municipal governments are adequately recognized as significant contributors to public health in Ontario? Mayor Mitchell, I'll start with you.
No, I don't think the public is aware of how much of public health is actually funded at the local level. I think one of the things that COVID has taught all of us is the importance of local public health units. Our ability to vaccinate our population, in large part, has been helped because of local partnerships that have been able to be formed between public health, between a hospital, between our paramedic service. And if this had all been centralized in one place in downtown Toronto, trying to service all of the province, that would have been a far more difficult thing to do. I think public health units have demonstrated their ability to adapt, their ability to respond to local conditions, and to take provincially wide mandates and to deliver them in a way that makes sense at the local level.
And Chair Redmond?
So I would tell you that every constituent cares about taxes and the rate they pay, but they honestly care about the kind of service delivery they have. And that's what has really shone a light on local public health units. And I would have to say that I sit on a couple of AMO boards, and I recognize that throughout the province of Ontario, we're diverse. There's 444 municipalities, and there is no cookie cutter solution. So here in Waterloo Region, we're a two-tiered municipal structure, and we drew on historic relationships with our area municipalities and accelerated those relationships. We were able to redeploy regional staff to do contact tracing, to be members of our vaccine rollout. We enlisted paramedics both to deliver vaccine as well as to do healthy checks on individuals who were aging in place. So the Board of Health can make real-time and tailored decisions for our residents. And we work very closely with primary care throughout this pandemic. So those historic relationships really helped serve our community in a way that a centralized system wouldn't be able to do.
And Mayor Lawrence, I wanted to ask you that same question. Do you feel that municipal governments are adequately recognized as significant contributors to public health in Ontario?
No, I don't. And I fully agree with what the other panelists have said, but you just have to look at the dollar value. The province contributes less than 1% of its budget. I think it's probably two-thirds of a percent of its budget to public health. Municipalities, we're contributing now 2%, 2.5%. If the change that they're proposing went through, we'd be contributing 3% of our municipal budget to public health, 3 or 4 times the percentage of the budget the province puts forward. And I don't think that's recognized. It's public health at the provincial level is undervalued. And the contributions of municipalities are undervalued as well. And also, we contribute to the district services boards through policing. We're doing public health. In fact, in our area, it's undervalued.
Why do you think that is? Why do you think it is undervalued, Mayor Lawrence?
I think that's traditionally in society it's been undervalued. I also think that within the province, at the provincial level, acute care essentially runs the healthcare system. I think it's an overvaluation of acute care rather than getting to keeping people out of acute care and addressing the social determinants of health through public health and other agencies.
And of course, Ontario is a massive province. It's a beautiful province, as I think we've all had a chance to explore this pandemic summer. But it's also very different. The concerns of people in the GTHA are very different from other parts of the province. What are your top concerns in terms of public health for each of your municipalities? Mayor Mitchell, I'll start with you.
Well, I think that, and Chair Redmond said it at the beginning, dealing with the determinants of health. What the pandemic has taught us is that if you live in poverty, if you have substandard housing, if you are at risk of domestic violence, if you're having to live in a congregate living setting, you are far more likely to be impacted by COVID. And that's true of all of the health concerns. And so if there's something that is clear that we have to deal with, is the root causes and to deal with those determinants of health.
But for your municipality, what are some of the challenges that you're experiencing when it comes to public health?
Well, the opioid crisis is a significant problem in our community. We've actually had more drug overdose deaths than we've had COVID deaths. Our emergency number of people presenting at our emergency department for drug overdoses is almost twice what it is provincially. We're in the process of trying to establish a safe treatment site and all of the ancillary services that go with that. And that's a major challenge for us. We're working on that. But that is a critical component. And it didn't take a holiday, or it wasn't put aside during the pandemic while we were fighting that. It has actually accelerated that problem. And we're trying to cope with it as a community. And again, it comes to being able to have a local ability to do that, bring local partners together to laser focus on what is a critical problem for our population.
Chair Redmond, I saw you nodding.
Absolutely. And I would tell you that the two shadow pandemics really is the opioid crisis and mental health in our area. And one of the things that this pandemic really shone a light on were the issues of equity around opioid use and issues around homelessness. When I reflect upon the weeks that we have weathered this pandemic, I have to tell you, I really hope we don't lose some of the learnings, because there have been some improvements. We worked with a community partner, House of Friendship, and it's a local organization that provides food, housing, addiction treatment, and neighborhood support. And they had a 5-year vision about wraparound services. And this vision was carried out in a matter of 2 weeks. So we're seeing the rewards of this. We're carrying the model forward. And I don't want to lose those gains. During the first wave of the pandemic, we housed 80 individuals at the start of the pandemic in a rapid response to evolving situations. So it gives me hope that we have seen new ways of delivering service that we can continue to do.
It's really nice to hear that, that's happening, because we've been hearing throughout this pandemic, 18 months on, that we're all in it together. And sometimes I think some people are like, are we really? Doug Lawrence, for your municipality, what are your top concerns in terms of public health?
In our municipality and in our health unit, we are 40% of the First Nations in Ontario are located within our health unit. The ongoing impacts of residential school, of the 60s scoop of other policies over decades that have created a very hard situation in First Nation communities, 25 of which are remote access, has created the population in Ontario that is the most marginalized in terms of any measure of social determinants to health. That has tremendous impact on our municipalities and health units. The three top costs out of 303 OPP municipality OPP police communities are in our health unit: Pickle Lake, Sioux Lookout, Kenora. Fort Frances is number 5. There's a reason for that, and it relates to the social determinants of health and the impacts on the First Nation communities and the overflow into the municipalities. That's ongoing, and it needs to be addressed. I think Canadians are only learning now about the impacts of residential school. Most people don't understand it, but it's there, and it's a tremendous impact, and it will be with us for some time to come.
I wanted to change gears for a minute because we've mentioned the shadow pandemic of the different things that are happening within your different municipalities. And of course, this is happening against the backdrop of COVID. How has the vaccine rollout been in your municipalities? Mayor Mitchell, I'll start with you.
Well, it had a slow start. Much of the original vaccine went into the hotspots, went into the GTA, so we were a little later getting started, and that took some time to get back up to speed. We're now very close to the provincial averages of 80 and 70, 81st, 72nd. But there is a distinct difference between our success in our urban core in the Peterborough city and what we're being able to accomplish in the county. There are some impediments, starting with... Well, at the beginning, it was primarily an online system for booking. You could use a phone as a backup. Well, I've got large parts of our Peterborough County that don't have access to high-speed internet, so it was a problem. Transportation is an issue. If you're in the city, you could take public transit. You might be able to get a taxi. There's population density. You can get to where you need to go to. But in a county, in a rural county like Peterborough County, transportation can be difficult. So there are some impediments. We're working on it. We're transitioning from our mass vaccination clinics to reaching out and going to where the people are. So, for instance, we'll have a vaccine clinic at a farmer's market. So that we're going where people are. So it's moving along, it's coming along. We need to recognize where there are gaps and to place our resources there, and that's what we're doing.
And how about you, Chair Redmond?
So I think that the community partnerships have been really what rolled our vaccine rollout forward. And I have to tell you, those partnerships were with cultural communities impacted communities such as the Indigenous community, the Black, the racialized community, and we had identified low-income, culturally sensitive areas. Our Indigenous clinics were led by the Indigenous community locally. They had Indigenous vaccinators and volunteers, and people were coming from 3 and 4 hours away because they knew how culturally sensitive this was. We had the situation where we went from, Andy's already talked about this, it was appropriate when there was a hot spot in the GTA that's where the vaccine was funneled by the province. But when we became a Delta hotspot and we did have the vaccine, it was our local medical officer of health, Dr. Wong, that decided that we would have a 2-week lag going from step 1 to step 2, because we then had the vaccine that we could go to the community, and we have now caught up with, we've actually surpassed some of the provincial averages for first and second doses. So it was that going to where people were and adopting things like the hockey hub, where we could get far more vaccine in arms with fewer volunteers. And it really was an all community effort that allowed us to do the catch up.
And Mayor Lawrence, how has the vaccine rollout been like in your region?
I think it's been excellent. For many of the reasons stated by Andy and Karen, we're sort of unique here in Sioux Lookout in terms of we're in the in-between world between federal and provincial, between municipal and First Nation. But the cooperation between our health unit, our medical officer of health, Dr. Kit Young Hun, and the doctors that are in charge of public health for the Sioux Lookout First Nations Health Authority in our area was tremendous. And then local cooperation in all communities. It really has. There's been a few hiccups here here and there, but I think the vaccine rollout has been one of the great successes because of local knowledge and control other than the supply of vaccine.
We've been hearing a lot about some people still haven't gotten their vaccines. How has vaccine hesitancy been an issue in your region? And if it has, how have you addressed it? Mayor Mitchell, I'll start with you.
Well, I think there's two parts to it. One, what I talked to previously was access. We need to make sure that we make it as easy as possible so that individuals can access the vaccine. And that's in part about going to where they are. I think that will deal with some of it. I think there's a need to continue to assure people about the efficacy and the safety of the vaccine. And we do that on a regular basis. Dr. Salvatara, our medical officer of health, has done a significant amount of work with her team at Public Health, assuring the public of the safety of the vaccine and how well that it works. And all of our partners, and both of our other guests talked about this, our partners have been doing the same thing, going out to their folks and letting them know how important it is, how that it's safe, and that it will make a difference. At the end of the day, the best way to protect yourself, your community, and your family is to get a vaccine and then to get your second shot. That's what everybody has to do, and I encourage everybody, if you haven't already had your vaccine, go get one.
I think your first point is really important because I think there's an assumption that people who haven't gotten their vaccine have done so because they might be hesitant. But as you mentioned, Mayor Mitchell, it could just simply be a question of access. Chair Redmond, what about you?
So we went out of our way to have frank conversations with faith and influencers in community faith groups and areas where we knew people might have hesitancy, and really had tough conversations. Dr. Kelly Grindrod from the School of Pharmacy did a really great job of debunking some of the myths, and that was really important. I think it's taking those concerns seriously. We've also done vaccine buses. We've expanded a homebound outreach. I know there was a real issue with some of the conservative and old order Mennonite, and we worked with the influencers in those communities and found that they would like to have a very understated access. We went to workplaces where we knew there were outbreaks amongst workers, often because they carpooled, lived together, and worked together. We've gone into high schools and high priority neighborhoods. We have mobile clinics. We have GRT buses that are stopping at malls and markets, and we're finding a great uptake of people in those situations getting their first shot even now, which is really exciting. And primary care has been part of our rollout from the very beginning, as well as pharmacies. So we've tried to do everything we can to make sure there are no barriers for people who are willing to get the shot. And with the homeless population, what we found was a lot of times when the outreach workers were the first in line to get the jab, other people would get in line behind them.
And Mayor Lawrence, what about your municipality?
I think in our area, there's been not too much vaccine hesitancy, although I think there's a hardcore ceiling that you hit and you get whether they're anti-vaxxers or anti-government, and some young people, I think a younger generation who doesn't think that COVID impacts them. I'm convinced, with all the other measures that have been put in place, suggested by the other panelists and used here as well, many of them, I'm convinced that whether it's a vaccine passport or vaccine exclusion. I know the Winnipeg Jets just announced they intend to fill their arena this year for NHL games, but only to double vaccinated people with proof of vaccination. That might encourage some young people or others who are reluctant because they want to be included in normal things, the things they like to do, to get vaccinated. We need something like that to raise the ceiling higher, I think.
We only have a few more minutes, but I don't know if this is, I have a two-pronged question for you, which we don't usually like to do, but one, any key lessons that you have learned from COVID? And the second part is, the next provincial election is 10 months away, and we're about 14 months from the next municipal elections. Is there one key policy change you'd like to see implemented going forward? Mayor Mitchell?
Well, I'll go back to what I said before about what we've learned, and that's the importance of dealing with the determinants of health. If you don't deal with that, it's very difficult to do the rest of it. COVID has just sort of echoed that in spades. And if there's a policy issue that needs to be dealt with, we haven't talked about it yet, it's got to be long-term care. One of the things that we didn't do well as a province and in many other places is to protect our aged population. We need to do a better job of that. We need to enhance our oversight. We need to build more units. We need to make the units that are there safer. That's got to be a key public policy drive as we move forward.
And Mayor and Chair Redmond, you've got 30 seconds, and then 30 seconds from Mayor Lawrence.
Okay, I'll try to talk quickly. We learned that the pandemic impacted some people more than others. But we also learned in Waterloo Region, and it sounds like in other areas that Andy and Doug represent and across the province, we're still a caring community. And I'm proud to say that Regional Council approved historic investment in upstream funding this year. So over $20 million over 2 years to respond to urgent need for affordable housing, $15 million over 2 years to invest in supports in Indigenous, Black, racialized, and other marginalized communities, and in the $3 million over 2 years in supports for businesses that are impacted by pandemic has seen us have an ambassador program where young students go in who are fully educated and help businesses navigate what each of the steps and the frameworks need to comply with, and then they get a sticker, and we're hoping that that really leads to more customer as well as employer confidence. We also put $70,000 aside for a 6-month project to deal with mental health, because we heard from our hospitality sector that they were really impacted by it. And I think that that speaks to the kind of integration we get when we have local public health units. As far as a policy as we go ahead, I really hope that the province continues to invest in paramedicine and other ways that we're currently part of a pilot project, and it allows people to age in place and for non-emergency services. And to me, that's a way of working smarter, not harder in our communities.
And Mayor Lawrence, you've got 30 seconds.
The key lesson is the central and core role that municipalities play in emergencies. People, agencies, businesses look to us to help coordinate and work with public health to coordinate, whether it be isolation rooms, vaccine clinic facilities, a whole gamut of things. And in terms of a policy change, it's to eliminate the mitigation funding the province has put in place, go back to the funding formula we had, and in fact increase it and make it not year-to-year funding, but guarantee it's annual, so we can hire people, we can offer people. It's hard enough to get people to come here anyway, but hire people knowing that there's a permanent job available to them, and also recognize that post-COVID, there are going to be costs associated with catching up with all the public health that we haven't been doing during COVID. We need stable funding, and we need guaranteed in place.
Thank you all so much for your time. We really do appreciate you making the time for the agenda tonight. Thank you so much for your insights.
It's been a pleasure.
Thank you very much.
And that's it for tonight's agenda in the summer. Tomorrow, we continue our partnership with the Association of Municipalities of Ontario during their annual conference with a discussion about the evolving challenges of women in leadership. I'm Nam Kiwanuka. Thanks for watching TVO and for joining us online at tvo.org.
The agenda in the summer with Nam Kiwanuka is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.